Good day, everyone. My name is Jennifer, and welcome back to the Clinical Recall channel. Joining me today is Francis, and we'll be covering 3 selected respiratory diseases.
For this episode, we'll be discussing 3 respiratory conditions, namely pleural effusion, emphysema, and acute respiratory failure. We'll go over their causes, signs and symptoms, and finally the interventions.
But before we dive into all that, is this your first time hearing about these diseases? If so, let's warm up with a quick fun game first. The rules are simple. All you have to do is unscramble the words based on what each person refers to. Are you ready? Have fun!
3, 2, 1, nice! Round 2, 3, 2, 1, amazing! Round 3, 3, 2, 1, perfect!
You did great! Did the clues light a bulb? If not, no worries. We're about to dig deeper into it.
To start, what exactly is pleural effusion? Pleural effusion, sometimes referred to as water in the lungs, is the buildup of excess fluid between the layers of the pleura, which are thin membranes lining the lungs and the insides of the chest cavity.
Pleural effusion is commonly encountered in Philippine hospitals and is often associated with conditions such as tuberculosis, pneumonia, heart failure, and malignancies, all of which remain prevalent causes of respiratory-related admission nationwide. Common clinical manifestations include chest pain, dyspnea, and orthopnea. Although, it's important to note that some patients may be asymptomatic, especially in mild cases.
In terms of prevention, it's generally advised to avoid tobacco products, avoid asbestos, low-sodium meals, take prescribed medications like diuretics, and lastly, limiting fluid intake if your provider tells you to.
For interventions, priority nursing care includes closely monitoring respiratory status, providing supplemental oxygen as ordered, and encouraging deep breathing and coughing exercises to promote lung expansion. If the patient has undergone thoracentesis or chest tube insertion, drainage should be monitored closely, and nurses must watch for complications such as pneumothorax. Proper positioning such as high Fowler is also important to improve breathing and comfort. Now, let's move on to our second topic, emphysema. So, what exactly is emphysema?
Emphysema is a lung disease caused by damage to the alveoli, leading to air trapping in the lungs.
This damage results in several telltale signs, including a barrel-shaped chest and reduced oxygen transfer into the bloodstream. What makes emphysema especially challenging is that the lungs is irreversible, although its progression can be slowed with proper treatment and lifestyle changes.
Similar to pleural effusion, emphysema is also prevalent in the Philippines, particularly among long-term smokers and individuals exposed to biomass fuel smoke. It significantly contributes to chronic obstructive pulmonary disease, or COPD, and is considered one of its main conditions.
For assessment, the signs and symptoms includes long-term coughing, often called smoker's cough, wheezing, shortness of breath, tightness of chest, increased mucus production, fatigue, trouble sleeping, and weight loss.
And for interventions, the focus is on management and slowing progression, which includes quitting smoking, bronchodilators, administering oxygen, antibiotics, and anti-inflammatory medications.
And now for our third and most critical condition, acute respiratory failure, often referred to in severe cases as acute respiratory distress syndrome or ARDS.
Acute respiratory failure is a life-threatening condition in which fluid accumulates in the lungs' air sacs, preventing adequate oxygen from entering the bloodstream and ultimately depriving vital organs of oxygen.
This condition is a very common cause of emergency room and ICU admission in the Philippines. It frequently results from severe pneumonia, sepsis, trauma, asthma, COPD, and COVID-19 exacerbation. Since this is an emergency, recognizing the signs and symptoms quickly is essential, which includes shortness of breath, tachypnea or rapid breathing, cyanosis or bluish discoloration of the skin, heart palpitations, agitations, excessive sweating, blurred vision, and lastly, fatigue.
When it comes to clinical interventions, the main focus is on providing immediate support, primarily through oxygen therapy, along with medications such as antibiotics, bronchodilators, corticosteroids, and more, depending on the underlying cause.
And that brings us to the end of our discussion on oxygenation challenges. This condition may differ, but they all affect the same critical goal: adequate oxygen delivery. As future healthcare professionals, recognizing them early can make a real difference in patient outcomes. Thank you for learning with us, and we'll see you in the next episode.